Hey, everybody that's just joining in. We can see more people trickling in. We're just going to wait a few minutes here to kick off. Make sure everybody joins in before we start the presentation. All right. While we're waiting on a few people to join, um, why don't we help us get to know everybody a little bit here? And Lorenzo, if you want to move us to the next slide here. Um, if everybody could just drop in the chat a couple things about yourself, specifically, um, this prompt of I work for a specific type of organization in this particular place, and how do I feel about facts, and a little prompt on automation and what you want to be doing with automation in the future. So take a second to put that together, put it in the chat so we can read it, get a better understanding of who we're presenting to here. And while that's happening, we will let a few other folks join in. As we can see, the attendees are popping up now here. All right. Cool. Why don't we get started here? Again, welcome everybody to Documo's webinar, from Invention to Innovation. From 1843 to AI powered workflows. My name is Dennis Whalen. I'm the CEO here at Documo. I live in a small little town called Marblehead, Massachusetts, which is about 10 miles north of Boston. And despite living in New England, I am a happy last year but hopeless Eagles fan this year, since we're not very good. And I'm joined by Lorenzo. Lorenzo, you want to introduce yourself really quickly?
Yeah, thanks, Dennis. Great to be here with you all today. My name is Lorenzo Davalle. I am the solutions consultant here at Documo, based out of Colorado Springs. And yeah, I spend a lot of time helping out customers both on the pre-sales side and post-sales, all of our customers that need help with onboarding and implementation and training and answering technical questions from A to Z. I'm here to help out with all those things for our customers. So great to be here with you all today and give you guys a bit of an insight on what we've been working on in-house. So
Awesome. Awesome. Thanks, Lorenzo. Lorenzo also has awesome keyboards that he makes at his house. He might show it to you during the demo. So, mechanical keyboards that make awesome clicking noises. So, by the way, we've all been to a bunch of webinars, and one of the things that I always enjoy about good webinars is a little bit of participation. So, what we wanted to do, one of the things that's a cultural element here at Documo is trivia. We do trivia internally, amongst our team sometimes, and we thought we'd start off with a little bit of trivia, in particular, facts adversary trivia. And so the winner of this trivia is going to get a $50 Amazon gift card. And so think of your answers fast but correctly, because speed and accuracy is going to matter here, just like processing PHI. All right, so you should see the trivia pop up here. And I'm seeing some of the answers coming in. A lot of good answers coming through. Who invented the first fax machine? All right, we're going to give it another couple seconds here for everybody to fill in. It's only 4 questions on the trivia. Get your $50. Buy yourself some Halloween candy. All right. Cool. We're gonna end the trivia here. Couple quick things I will answer. Um, a couple of the trivia questions almost right off the bat. So Lorenzo, if you go to the next slide, the Faxiversary, and you probably could have Googled this, but maybe you would have gotten the fastest score. But the person that invented fax is a man named Alexander Bain, and his birthday was actually in October, 181 years ago. So in 1843, he actually invented fax, or the fax prototype. And it's kind of wild to think about that today in 2025, almost 2026, that this invention still exists in healthcare and other industries. And it's a testament to his invention, but I think it's also a slight against our ability to innovate in the healthcare space. And so we want to talk about a little bit of how we move from invention to innovation overall. And the problem that exists in healthcare, Lorenzo, if you go to the next slide, um, is multifaceted. There's a huge amount of regulatory compliance that exists, almost $40 billion annually. That's spent on compliance related administration. Lorenzo, and you can just progress the slide all the way through. Perfect. And so almost 40 billion spent annually on compliance related administration. And that 40 billion is only in the top 25 healthcare systems in the US. And so the administrative burden that exists and comes from fax is crazy. And not just that, but 75% of all healthcare communication is still sent by fax. So, our communication methodology through fax continues to dominate. And faxes require a lot of manual intervention. And we did a recent study on this. 52% of faxes still require manual intervention and processing. And that causes a lot of issues downstream in healthcare, not just for the providers, but for the patients themselves. And really, when I think about the patients, Lorenzo, if you go to the next slide, 88% of healthcare professionals are saying that fax is so problematic that it's impacting care for patients. And so, yes, there's a big administrative burden, $40 billion in the top 25 healthcare systems, but also, when you think about speed of care and quality of care for patients, like a streamlined administrative operation is a really important way to be able to support patients. I actually saw a post on LinkedIn today where someone was like, you're telling me that I can track the exact minute and location of my pizza coming from Domino's, but I don't know where my prior auth request is that's going through fax in today in healthcare. And like it's an example of hyperbole, but it's one that is absolutely true. And this manual processing overall isn't just a patient impact issue. There's errors and accuracy issues. There's less invested in administration and headcount for administration in healthcare today than there was last year. And that's causing more burnout and turnover in terms of the administrative staff. And ultimately, it leads to these document delays and processing delays, which aren't just annoying, they end up being dangerous. And if you go to the next slide, um, there has been small movements of innovation, and we have moved from paper fax and like the hum of the fax machine, although 25% of the healthcare market still uses physical fax machines, to fax servers, to cloud fax. And so the majority of people are getting into and have adopted cloud fax, which is really just a digital view of the actual document itself. The real difference of why, well, not difference, but the the reason that these cloud fax businesses in general have not solved, the downstream workflows is the vast majority of them are telecommunication companies. They are focused on the delivery side of the communication and not focused on the downstream workflow that exists and the amount of document chasing and processing that needs to exist once a communication hits a provider. And much of the health tech communication innovation side of things, where you have communication providers that could be innovating on a new type of technology to be able to transfer information, there's this really utopia view or utopic view of how they can transform and disrupt healthcare by creating a new communication mechanism that ends up just making communication more complicated in healthcare. Um, and one of the things that we focus on at Documo is really trying to meet the problem where it's at. Um, and so, Lorenzo, if you go to the next slide here, there is a shift that is happening with innovation around AI, where we've gone from the invention of the fax machine to innovation with faxes in healthcare, and in particular, that innovation is around intelligent document processing, where faxes can be automatically read, they can be classified. Key information can be extracted and then ultimately matched with the right patient in the right system at the right time, and then ultimately be able to spin off a number of downstream workflows. And what we're seeing is that for innovators that have adopted this, they're saving 5 to 8 minutes. Excuse me, what was 5 to 8 minutes in their normal process is now happening in only a few seconds. And so there's this invention that happened in the 1800s. Now, finally, we have the ability to innovate on it and take what is a very unstructured piece of information and turn it back into, reconstruct it into a structured piece of data that then can be acted on. And what this means practically is these unstructured documents, these faxes. What's happening is there is OCR that's actually being run on the document, which allows for the reading of the document. That enables technology to be able to figure out what the type of document is. So is it a referral? Is it a prior auth? Is it an intake form? Right. And then with that, understand who is the patient? How do I match them with the key extraction data points to be able to identify that individual in the EHR and pair this document up with the right patient? And this kind of compression of action can happen in a few seconds, not even in under a second. And I think the really important thing here as we think about innovation in the future is that making sure that we're not just automating for automating's sake, that we're automating responsibly, which is something that Lorenzo is going to show here in a little bit of a demo. So in summary, from our perspective, like one of the biggest value points of innovating this way is, yes, there is speed. Yes, there is a reduction in administrative overhead, which reduces burnouts. Yes, it increases accuracy and improves automation and efficiency. But most importantly, from our perspective, is if we can improve patient care through speed and accuracy, that is kind of the coup de grace of automating faxes in healthcare. So if we move to the next slide, Lorenzo, really quickly, um, I think the big takeaways here are like fax isn't going away. Um, you know, but how we handle it is changing, right? And this invention that has really defined healthcare in potentially a bit of a negative light over the past, 100+ years, has the ability to change, right? And there's a huge opportunity for automation. We did a study recently and found out that 2/3 of healthcare teams still haven't automated their workflows yet. And so there's a huge amount of opportunity to be able to automate and improve processes. And the next chapter adopts a combination of what technology, albeit legacy, exists today with rising, amazing new technology that is AI, right? And ultimately eliminates these manual processes to improve patient outcomes. So with that, I wanted to actually show a practical example of this and have Lorenzo do a little bit of a demo here on how the technology works and what we're doing here at Documo to do exactly what we just talked about. So with that, Lorenzo, I'll let you take it away.
Yeah, perfect. Thank you, Dennis. So for this portion of the demo, we're actually going to transition away from the slides and actually over into our product here. So this is in our production environment. This is all stuff that is available for our customers and folks who are looking to utilize the product that's available to all of them to use today. And for those of you who are familiar with our web portal, you may notice we've got this extra little extension of the traditional fax product that most, if not all of our customers are already familiar with utilizing today. And that's up here in this section that we call workspaces up here. So all of the processes that Dennis had referred to and talked about there, they really all start from workspaces here. And so what this product allows you to do is to set up these workspaces. And you can see here, I've got two different ones that are both set up as my test here. But these are what allow you to route documents to folders and where those processes can take place. So if we take a look at, we'll just use my first test one here as an example. There's a couple of different configuration things that you have that you can do at the workspace level that allows some of those processes to be run automatically to further streamline that process and save some of that operational time it would take even to receive that data, right? So if we go into edit this workspace, here is the bulk of what you have the ability to configure as far as that automation goes. So for those processes being OCR, document classification, and the extracted fields from those documents, we can set all of these individually to run automatically. So whatever documents end up landing in this workspace, whether these are ones that we're manually pushing here, that their source may not be a fax and come from a different application, or these are fax documents that end up landing in this workspace, we can pick and choose what we want to have run automatically here. In addition to that, obviously, you have the ability to set that document retention, and this is kind of one-to-one with what our fax product is. So again, those of you who are familiar with what that looks like, it's up to a year there. So there's no cap on the number of documents or anything along those lines, just the period of time in this individual workspace that we set that up for. Now, another great thing is that everything that you can do in the Workspaces product is also available through the API. So to further automate for folks who are looking to integrate and looking to kind of plug this process for improving the ability to pull information from documents into another workflow or into another application or do it in tandem with your own product for your customers. That's all possible. But obviously, for the sake of doing things through our interface here in the demonstration today, you also have the ability to assign different people to these workspaces. So you can pick and choose who has access to these and who will need to review these documents if there's anything manual there, or even for those that want to be able to pull this information. Maybe you just need an improvement on being able to grab that information and copy and paste it somewhere else. And that's as far as that improvement goes for your organization. So anyway, you can add who you need to here, which is great. And then, as I mentioned earlier, for data sources, you have the ability to set up fax numbers as those documents or as those data sources, excuse me, to this workspace. So, for example, you can see I have this 720 fax number that is set up here currently, and that'll allow us to route all of the inbound documents that are received to this fax number directly into this workspace. So at the same time that anyone who would have access to this in the fax product would be able to view that in fax history, it would also land in this workspace. So all those things happen one-to-one there. Now, if we jump into the workspace, you'll see I've got some older documents in here just to kind of give you a brief view of what all of that looks like. And we'll add some new ones in here just so we can see what that process actually looks like. But a few quick call outs for what you have access to within the workspace itself. So first and foremost, we've got the document names, the dates in which they were added. We can see patient names as those were pulled. The type category here will give us the indication of the classification that was assigned to those documents. Again, as you may have remembered before, in this workspace itself, I do have all these processes set up to run automatically, so those will pull and show up in most cases before you even gain access to viewing the document showing up here. You'll get all those at the same time there. Then we can also see what the source of those documents were. So we can see for this first one, this actually came from a fax, whereas all the other ones down here were ones that I had manually uploaded. You can also see what the status of those documents are. So whether it's something that's brand new that no one's pulled up and viewed yet, or maybe this is something where we're needing to push this over to our EHR, and we can see that status reflected here through our integrations to different EHR providers that are all accessible from workspaces here as well. So all great stuff and should help you be able to identify what's been done with a document. Again, when multiple people are added into this workspace, want to know who's done what there. So yeah, so we're going to add a couple of different documents into this workspace here. So I'm actually going to pull these from here and we'll see just how quick those processes happen with getting the extraction, the classification, and then also being able to pull that OCR data. So we'll actually grab two different documents here, and I'm going to just drag and drop those directly into upload. We're going to hit save here, and we now have those documents available. So if I click the kebab menu here, as we call it, on the right side of the screen, this will give us all of our actual actionable points for the documents that have been added into the workspace here. So we can see we have the ability to pull up and view that document, so I can see all the information that's been added based on that document. But the most important pieces here are the ability to pull up the information for the classification and the extraction and the OCR. So we can do all that from viewing the info and history here. And this will actually pull up a full audit log of all of those actions as they happen. So at the very top, you can see that I had just pulled up and viewed that document. You also have the ability to see all of those processes in chronological order, which happen to be in the same minute that I just uploaded this document, and all those things were applied. So you can see for this particular one, based on the model that I have assigned to this workspace, that the document class was assigned as an advanced directive here. We can also see that there were 5 fields that were able to be pulled. So we were able to pull that patient first name, middle name, last name, date of birth, and the date of the medical encounter here. So there's a full list of those that are available for fields that can be extracted, but to further help improve upon that workflow of getting those key pieces of information out of a document to help determine what we need to do with it, this is where you would find all that in our UI here. Again, we can also view all the other further metadata for the document from this page, but this is kind of your main audit log for those documents there. Now, the other piece is being able to pull that OCR data. So again, from this kebab menu, if I go down here, we also have the ability to pull that full data. So here on the left side of the screen, we can see all of the text that was able to be extracted from this document, which would include in this particular case, handwritten signature as well as all of the fields on the document itself. So for those who are looking to pull everything from a document or are looking to pull things maybe outside of the scope of what extracted fields we have the ability to deliver today, the OCR option is really the sure shot way of making sure you're able to pull any information that you need from a document to, again, further improve upon that process for what you need in your workflow. Last piece I wanted to point out in here are the EHR connections. So you can see we've got a couple of different ones that are available in this particular workspace. OpenEMR, NextGen, and ModMed. So these would basically give you the ability to open up the document processor window. And from here, you'll have the ability to push and pull documents directly to your EHR. So when that's all set up and connected, if an important piece of that process in this particular case would be to move this document into OpenEMR and assign that to a patient's chart or a particular encounter or whatever the EHR calls for as far as how those things can be attached. That's something that you can all handle here. And we can see even for those fields that had been pulled automatically, if we hover over that, we can say, hey, this field assignment was done by AI. This was done automatically. And obviously in the case where you need to change those, you can and move it on from there to be able to send that over to attach that to our EMR there. So just another piece of what's possible in improving that process. But yeah, hopefully that helps give you guys a good understanding of some of the things that are possible. There's obviously a lot more to it than that, but should give you a good indication of the setup that you can have to be able to get the data you need from those documents to improve on that process.
Awesome. Thanks, Lorenzo. Hey, couple questions that have come in through chat as we were going through. Um, is this available via API for health tech providers to be able to snap into their systems and their inboxes where they may be actually processing faxes today?
Yeah, absolutely. Happy to answer that one. So the answer is yes. That is available through the API. So in our next documentation, which I have pulled up here, We have different collections that are available in here that will give you endpoints to perform all the actions that I showed you and to be able to obtain all of that same information that was accessible in the UI from the web portal here, right? So we've got an OCR section here, and then we've also got this workspaces section here. There are some subfolders and categories to find all of the endpoints and information that you need on that. But to answer that one in short, the answer is yes, that is all available to use from an integration perspective.
Awesome. And then there's a follow-on question to that, which is which EHRs are you connecting to now, and are you planning on adding others into the future?
Yeah, definitely looking to add more. I think a lot of the validation that we've done in our research to build the integrations that we have available to our customers today has been through, feedback from our customers, feedback from people who are interested in the product. So, definitely looking into what next year has to offer for us. It's definitely something where, if capacity is available and there's enough interest in something, we're definitely interested in adding it. But as far as what's available today, the main ones that you would see from here are would be next gen OpenEMR and ModMed. Those are the primary ones that would show up there. But yeah, if there's anything that you're interested in, feel free to reach out to anyone at our team. Support, sales, happy to facilitate the requests for anything that people are looking for.
Awesome. Awesome. Thanks for that. And there's another question that's come through here. How are you determining the difference between, let's say, a referral order versus a lab result, just to make sure that the data lands right? Um, how is that happening?
Yeah, great question. There's a couple of different methods that are used to determine that. The large piece of determination that goes into that by each workspace is the model that is used with that specific workspace. So there are basically two avenues that our customers have when looking at that. The first is to use our general model, which is something that we've taken quite amount of time and pride and work to be able to put together to differentiate basically a set list of different document classification types. And so, in my particular case, in my workspace here, that's what's currently configured is to use that general model. So, I've got a list of about 20 or so different document classes that would fall into that. We find that a lot of our customers typically can consolidate, even if their list may be more extensive than that. We've talked to some folks that have 50, 100 different document types, but really they fall into a few categories there, right? And so typically that will reflect that in the consolidation that can be done with our general model there. The other avenue is we can help custom train a model that best fits your use case. So maybe, hey, there's only 5 or 6 document types that we would want to utilize out of that model, and we have a great sample size of those documents that are available that we can help use to get the most accurate results for those document types that you use day to day. That would be kind of our category B there, and that's something that we can, work with you on to be able to put that together and make the best results happen for you for your use case.
So Lorenzo, is this there's one that just popped up here, specifically that can this be used at a dentist's office? They have 800 offices with their clients that are nationwide. Can it be distributed across many offices?
Yeah, absolutely. This can be set up in a manner that, hey, maybe we want each office to have their own, workspace that's set up in here. And we've got, one fax number or 3 fax numbers per office, and we need all of those to land in their own separate places to help keep track of those accordingly and not have documents overflow between them. And for any of those processes to happen, whether you're using it in the UI, you're using it from an integration perspective, there are plenty of ways to help, make sure that data is segmented across those 800 locations or 1,000 locations or however many exist. But the process would be, more or less the same between all of those, whether they're logging in and doing that, or again from an integration perspective there.
Awesome. There's another question here, and I can take this one, Lorenzo, which is, what's next for Documo's roadmap, and what are we going to build out beyond IDP? I would just say like lots. And if you talk to our product team, which I would encourage you to do, we have a great product organization. There's 3 big buckets that we're thinking about for the next, kind of 12 to 18 months and sooner than that. which is we want to continue the IDP work that Lorenzo's showed you here. So intelligent document processing, expanding the amount of field extractions that are available, being able to even further harden accuracy classification models, and the ability to actually process data fields that are required by the EHR that may be accepting the document. So even deeper than where we are today. Number one, number two, we really want to start enabling more automated workflows that users have the ability to both build themselves, but also use natural language to build out a workflow for what could happen to a document after it lands. And what we're finding is that there's endless use cases and opportunities once you know what's in a fax to be able to trigger workflows. And so that's going to be a second thing. And the third thing is we want to continue to expand out our EHR and practice management integrations. And so if you have an EHR or a practice management solution, and you're working with our team, please let us know. Please raise your hand. We definitely want to bubble those up as we continue to invest in the future. So, um, and another one here, Lorenzo, for you to take. What kinds of human in the loop feedback or training loops are in place to make sure that we're improving accuracy and reducing risk?
Yeah, so I think the biggest thing is being able to set thresholds in which we can, verify the accuracy of data that's going through there so that people who are relying on that data being extracted accurately are confident in the results that we're able to obtain for them. Currently, that's something that we're kind of managing internally, and there will be more user-facing controls in the near future to be able to more fine-tune what that looks like, so that you can say, hey, if this doesn't meet, X threshold, then don't give us results for that, or let us know that we weren't able to meet that threshold and we need to manually review for these certain particular fields. In most cases, when you're talking about data extraction for looking at things that are text-based versus handwritten, in probably 98% of cases of text-based documents, you're going to find that a lot of the typed information is extremely accurate in the way that it's able to get pulled there. It's very far and few between that things aren't able to be pulled accurately in that particular category. With the handwritten items, on the flip side of that, sometimes it's a blend of both. You have purely handwritten documents, you have typed text documents that contain handwritten fields in certain areas of that document. The general consensus there is if you can read it, so can OCR. If you can't read it, it's probably going to have a tougher time. But with that being said, being able to meet those thresholds and understand that, hey, if we wanted to meet this certain category or this certain, quantity of acceptance, that we can set that and ensure that, if it doesn't meet that, we're not getting results there. So,
Awesome. Awesome. Um, we're going to take one more question here. And Lorenzo, I can take this one.
sure.
You've said the fax isn't disappearing. H- how do you see, the future of what's being used to be able to communicate? From my perspective, I think the shift here is not going to be the modality in which you communicate, because it's all going to enter into the same data standards eventually. Like fax is just going to be a form of communication that will be absorbed and then ultimately displayed via the structured data that's required to execute whatever process needs to happen next. And so, while fax may not be going anywhere, I don't think people are going to be managing them the same way in the future. I think it's going to be way more automated with a lot more AI, and the way you're going to interact with the fax is going to be no different than you'd interact with any other communication without the manual effort. So that's how I'm thinking about the future. Um, so with that, um, there's a couple things we've got a new study and survey that has recently come out, and we could share that in the chat for everybody. Certainly worth taking a look. There's a lot more data on there and research of of what's going on in the market and understanding what the ROI could be for implementing more automation around your faxes. We're also going to be attending the health conference next week in Las Vegas from Sunday to Wednesday of next week at the Venetian. If you're going, please look us up. Please drop us a note. We'd love to connect with you. If people have any further questions, we'd love to individually engage and talk to you in a passionate way about what we're trying to do to innovate off of a not so innovative solution in healthcare. So with that, I want to thank everybody for coming. We've already done the Q&A, but I want to thank everybody for coming and attending, and very much appreciate everybody's participation. And the winner, by the way, for the trivia is Danielle Cohen, and so we'll be following up Danielle with your gift card. So thank you all very much for attending our webinar, and look forward to chatting with everybody next time. Have a great day.
Thank you all.